Today, we are diving into a pretty radical idea. What if a treatment we almost always associate with fighting cancer could actually be the key to solving chronic knee pain? Let's get into the fascinating new research on osteoarthritis.
I know, it sounds like a strange question, doesn't it? Radiotherapy, we almost exclusively link that with treating cancer, but a really fascinating new clinical trial is asking us to think about this powerful tool in a totally different way, not as a weapon against cancer, but as a potential solution for everyday joint pain.
And believe me, the need for a new solution is absolutely massive. We're talking about 33 million people in the US alone who are dealing with osteoarthritis. And this isn't just some minor ache, it's the single leading cause of disability among adults. It impacts millions of lives, every single day.
So let's first unpack the problem here. For folks with osteoarthritis, the path forward often feels like you're caught between a rock and a hard place. There's this huge, painful gap between just taking medication and having a major, life-altering operation.
You know, at its core, osteoarthritis is just the slow, steady breakdown of our joints. And it's not just about the wear and tear on cartilage, it's about the very real, often debilitating consequences. The pain, the swelling, and just losing the freedom to move around easily.
The current journey for a patient is pretty much a standard playbook. You start with physical therapy and painkillers. If that doesn't really work, you might move on to corticosteroid injections, right into the joint. And when all of that fails, well, the final option is often a total joint replacement surgery.
Now, this really gets to the heart of the frustration for so many people. The medications we rely on, like NSAIDs, and that's your non-steroidal anti-inflammatory drugs like ibuprofen, they come with serious risks if you use them long-term. And on top of that, for a lot of people, they either don't work from the get-go or they just stop being effective over time. That leaves them in this painful limbo before surgery is the only option left.
The study's lead author, Dr. Byung-Huk Kim, he puts it perfectly. Patients are just stuck. Do you risk the side effects of taking medication every single day? Or do you take on the pretty significant risks and the long recovery time of a major surgery? It's a terrible choice to have to make.
And this is where our story takes a turn. We're moving from the problem to a potential solution that comes from a very, very unexpected place: radiation therapy.
Okay, so this is absolutely crucial to understand. Not all radiation is the same. The high-dose radiation we use to kill cancer cells is basically like a wrecking ball. Its goal is destruction. The low-dose therapy that's being studied for arthritis is completely different. Think of it more like a dimmer switch. It's not designed to destroy cells, but to just turn down the inflammation.
So how does it actually work? Well, inflammation is a huge driver of osteoarthritis. It creates this kind of toxic environment inside the joint that leads to pain and even more tissue damage. Low-dose radiation seems to just calm that whole environment down, breaking that vicious cycle of inflammation and pain.
All right, so the theory sounds really promising. But does it actually work in the real world? Let's turn to the clinical trial that put this whole idea to the test.
The researchers in South Korea designed a really clever study. They took 114 patients and split them into 3 groups. One group got what's called a sham or a fake treatment, just to act as a baseline. Another group got a very low dose of radiation. And the third group got a slightly higher, but still pretty low, dose. And this wasn't just some simple test. It was a single-blind study, which means the patients had no idea if they were getting the real deal or a placebo. But here's the most important part, the real kicker. They were asked to stop using strong painkillers. And that is a huge deal.
Just as Dr. Kim explains, in so many other studies, patients are still taking powerful painkillers, and that can make it totally impossible to know if a new treatment is really working. So by taking those drugs out of the equation, the researchers could get a much, much clearer picture of the radiation's actual effect.
Okay, so the stage is set. We've got a rigorous trial, a clear methodology. So what did they actually find? Let's get to the good stuff, the results. After just 4 months, the difference between the groups wasn't small. It wasn't even moderate. In fact, the results were absolutely striking.
And here it is, the main finding. In the control group, the one that got the sham treatment, 41% of patients said they felt better. And that's pretty normal, right? That's the placebo effect. But in the higher dose radiation group, a massive 70% of patients were classified as responders, which means they had significant improvements. I mean, going from 41 to 70%, that is a huge jump.
And it wasn't just some number on a chart either.
The patient themselves said they felt much better. They had less pain, less stiffness, and they were able to function better in their daily lives. That's what really matters.
So what about safety? Of course, that's the number everyone wants to see. Well, in the short term, 4-month follow-up, there were exactly 0 observed radiation-related side effects. That's an incredibly encouraging sign, for sure.
Okay, so the results are definitely promising, but what does this really mean for the future? And what does it mean for anyone watching who might be suffering from knee pain?
Dr. Kim is really clear about who this is for. This is not a miracle cure for a joint that's already completely worn out. But for those with mild to moderate osteoarthritis, this could be a total game changer. It could be a way to manage pain and maybe even delay or possibly avoid the need for surgery altogether.
But, we have to be balanced here. Another expert, Dr. James Yu, who wasn't involved in the study, he raises a critical point. Even with low doses, there is always a long-term theoretical risk of cancer. And because of that, he suggests this treatment would probably be most appropriate for older patients, say generally over 60.
So let's do a quick reality check. This is one very promising study. It hasn't been peer-reviewed yet, which is a key step in the scientific process. The patients are still being followed to see if the benefits last and if any long-term issues pop up. So there is still more to learn.
But it leaves us with this really fascinating question. This kind of therapy was actually used for conditions like this decades ago, before it kind of fell out of favor. Now, with new research and a much better understanding of how it works, you have to wonder, could this forgotten treatment be on the verge of a major comeback? A new weapon in the fight against chronic pain? It's a question we'll be watching very, very closely. Thanks for joining us.